Hello, my name is Dr. Suzanne Shug. I'm the CEO and co-founder of Teleplus Healthcare, a chronic care platform that focuses on hard-to-treat disease states, creating large opportunities for us. So just going to show you our quick run-through of our platform. This is white labeled for New Jersey Cardiology Associates. I'm just going to log in just to sort of expedite things. I'm just going to go through, this is our remote consent. They'll be signing on a tablet, so just showing that really quickly. Before then, we enter them into our system. We then have them listen to their patient education. So we quickly go through everything from medications to what they need to do.
Be sure these products are packed in water.
Then we can go into our patient list. When we're enrolling a patient, we go into all the general information, who their doctor is, what their phone numbers are, pharmacy, so everything on. So if there's a nurse or doctor covering on the weekend, they know how to get in contact, all patient education, what medications, what hospital they're in. On this nurse dashboard, you'll also see specific answers to their questions, as well as daily measurements to their, in this case, blood pressure and weight. And then you'll see daily contacts and memos. So how long the duration, phone call, email, how they were contacted. What you will see, this is from the provider side. Let me go back and show you the main dashboard, and then I'll show you from the patient side. So if you'll notice on the top, it says need to call, need to review, completed and reviewed. So this lets the nurses know quickly who they need to address right away. You also notice the red, yellow, and green coding and white is non-compliant. So from the patient side, they're told to take their vitals every morning, answer questions every morning between the hours of 6 and 11, and at 12, the nurse checks the dashboard. So the patients, they get this setting on their tablet. Please fill in our daily questionnaire, and they start from there. And the easy to read button. So did you gain 3 or more pounds last night? Yes or no. And then they have prompts to sync their blood pressure. So that's how you get the trends. So once they do that, then the nurse checks the dashboard, and they can easily find out who needs to be dressed right away. Thanks for your time. Please contact me if you have any questions.